patriotism, faith, national unity, education, fiscal responsibility, civility, the values that define America. Fascinating stories and talks from America-loving patriots dedicated to preserving freedom, opportunity, and justice. Welcome to the Friends and Fellow Citizens podcast. Hello, everybody, and welcome to another episode of Friends and Fellow Citizens. I'm your host, Sherman Tylowski, as usual. Thank you so much for listening to this show. I hope you will enjoy it. We've got plenty of other episodes for you to check out. But today I've got another special guest with us. He's actually a recurring guest and one of the first guests to appear on Friends and Fellow Citizens. I'm so glad that he's back. We have Pat Yaro back to tell us more about Europe, but more specifically, Europe in the midst of the COVID-19 pandemic. There's been a lot of reports and articles about the situation that's happening in Europe, but what are some of the more intricate details that perhaps most people might not realize? We're seeing some very sharp contrasts going on in the continent, and while we often hear the narrative about Europe trying to act as a unit, I think there's a lot of evidence showing that that is not simply the case. And here with us to share more about this subject, I want to welcome Pat again. Pat, thank you so much for agreeing to do another episode with us, and it's great to welcome you back onto Friends and Fellow Citizens. How are you?
I'm doing fine, Sherman. It's my pleasure to be back on your show.
Today we're discussing how COVID is affecting Europe. But it's certainly inaccurate to say that Europe has a healthcare system, because healthcare works very differently over there, but it's not handled by the European Union or handled continental wide. So, Pat, give us a sense of how COVID-19 has affected Europe as a whole, generally speaking.
Yeah, so let me start by saying that we are facing an unprecedented crisis. And this applies to the United States, to South America, to Africa, to Asia, not only to Europe. And the reason why this crisis, this coronavirus pandemic is unprecedented is that we have to deal with two major problems. The first is a health problem, a virus, a contagious, deadly virus. And the second is the economy. In the 20th century and before the 20th century, Europe had to deal with many crises, including wars, recessions, natural disasters. But in those times, there was only main tasks decision makers, politicians, and the population had to focus on. In case of war, they had to manufacture military equipment and fight. In case of a recession, governments had to figure out what type of monetary and fiscal tools they have to boost the economy and to stimulate production. In case of a natural disaster, people had to be careful to watch out. The government had to protect people. They had to implement further preventive tools for the future. There's only one crisis, both in Europe and the United States, I think that is comparable to the ongoing situation. And this was the post 9/11 situation, when there was a dilemma for decision makers and there was a multi-layer task. And the two pillars of the post 9/11 thing was protecting people, focusing on security, but also protecting people's individual liberties and the Constitution. I think the ongoing situation is so unique for the same reason why the post 9/11 situation was that unique. We have to protect people, we have to save people from the virus, and on the other hand, we have to get the economy going and we have to save jobs. So when we look at continental Europe, the crisis hit it hard. We have a lot of cases here. The main problem is, and as you mentioned earlier, that there's no such thing as Europe. There's no such thing as the EU when it comes to healthcare. The European Union has no administrative duty or task when it comes to healthcare. There's a commissioner for health and food safety, medical services, and healthcare is run by national governments, by the individual states.
One of the most hardest hit countries in Europe was Italy. How does Italy's experience with COVID-19 in early days of the pandemic reflect the greater challenges that have been felt across various European countries?
Right. So I think everyone remembers that in Europe, COVID started with the crisis in Italy last February. We all saw the heartbreaking pictures on media from northern Italy with the terrible toll it had on on the Italian population. I think the major difference is cultural and political among all these states, and all the three countries we are talking about had underlying problems and underlying circumstances before COVID hit them. So when we talk about Italy, it's a big country with several regions. So what I have to say that although it's not a federal country as just as the United States or Germany, but power is devolved to regional governments. And this is one of the I think one of the components of the governance side of tackling COVID there. There's also a cultural aspect of it. Italians are not the typical Northern European strict followers of rules. I think the Italian lifestyle is definitely a condition that led to a catastrophic few months last year. And also, I have to say that the fact that the first major outbreak happened in Italy was definitely a political and medical handicap for them because they had no prior experience.
Yes, indeed. And there will be many, many accounts of whether or not this really impacted the response from Italy. I mean, there's a number of factors here that we don't have the time to go through today. But the other country we wanted to touch upon today is on the UK. The UK is being one of the largest economies in the world, but also had quite a bit of a topsy-turvy response, depending on the circumstances, depending on the timeline you're referring to. So what can you tell us, in your view, about the UK's response and the impact that COVID has had on the country?
Yeah, so when it comes to the United Kingdom, um, a lot of people say that they didn't take the pandemic seriously in the beginning, and this is the reason why they have one of the highest death rates in Europe. It's 0.18%, which is among the worst. I have to say that I think this is also a cultural thing. When we go back to British values, and the protection of civil liberties. I think this is the reason why the Johnson government didn't react right away, and they try to protect people's freedom and also try to keep the economy going. But also, the prime minister had a personal experience with the virus last spring, and I think that was a milestone. And after his hospitalization, after his recovery, we could see a change in attitude. And now, when the vaccination is going on, we see that the United Kingdom is among the best vaccinated countries in the world. They are actually ranking number three after Israel and the United Arab Emirates.
A quick thing about the UK, they have something called the National Health Service, also known as the NHS. This differs a lot from European healthcare systems overall. I think in a European country, for most European countries, a healthcare system is, well, a healthcare system. And that's it. It provides medical services whenever people need it, usually single taxpayer or other form. But the NHS is very different, isn't it? It feels like it's got a bit of an identity attached to it. That's something that maybe not a lot of countries kind of comprehend.
It does. It does. The National Health Service was established right after the Second World War, and it runs the entire single-payer healthcare system of the United States. Actually, it has three branches: one for England, one for Wales, and one for Scotland. But in the 1990s, after Tony Blair's victory with his new Labour politics, the NHS became, I think, over politicized. And due to Blair's extreme funds and extreme political focus on healthcare and the NHS, we can say that as of 2021, the NHS is one of the most important factors in British politics.
Could not agree more with that, especially someone who previously lived in London for 3 years. I can tell you that it really is somewhat of a glorified institution, for better or for worse. I think we can leave the NHS for another episode. I mean, there's probably some notable bureaucratic issues with it, just like any bureaucracy. I'm not very familiar with the details about what it has to be changed. It's just not an area of expertise that I'm comfortable going in at this time. But it really is important to note how significant it is and how it's shaped British politics, as you've pointed out. And maybe the politicization is the worst enemy for the NHS. Maybe it's not funding or lack of funding or limited funding, or maybe of some of the deals that they make with drug companies. Maybe it's something bigger. But I do think what you have said about the NHS is really right on. And something that it's going to be largely discussed and continues to be a source of huge debate over its role in the COVID-19 pandemic. But there's no doubt that it's played a huge role in that success for the vaccine rollout. Well, let's move on to Sweden. Sweden's a bit of an interesting case, isn't it?
Well, Sweden was a big surprise to me. It is one of the more progressive countries with big government in Europe. And the approach they took, I think, was a really brave approach. And it was an outlier among all the other Nordic states. So Prime Minister Stefan Löfven decided not to mandate masks for people. He decided that restaurants and schools should stay open. And even though Sweden received a lot of criticism from the EU, from international media, the actual numbers we have as of today, prove that they did pretty well. Sweden's death rate is 0.12%, which that matches with the EU's 0.12% death rate, and their GDP contracted by 4.7% in 2020, while the EU's GDP contracted by 7.4%. So I think we can say that Sweden's decision to take that route and to go their own way paid off for them.
The Swedish scenario proved to be something much bigger than just a COVID-19 response, but it really reflected just how poor a lot of discourse has been about the varying differences amongst countries' responses to COVID-19. Look, we want to have what's best for each nation. We don't want this pandemic to harm the lives of people around the world. However, I think it's very critical to be able to learn from all these different responses, because when we look back in the future years, there's going to be some things where we're going to look back and say, man, we really screwed up on that, or we should have done that, or we should not have done this. It's just a bit too early, I think, for people to just count out a country like Sweden and say, well, they went the way that we didn't go on, and I just can't really buy that. We need to be able to learn, right, from these different responses and put it on our hats of analytics and intelligence, and just be able to reflect on and learn from the things that we did do and that we didn't do.
Yeah, I just want to say one thing to react. I think this is the point that whatever it's a natural problem, natural crisis, or an economic crisis, or a healthcare situation like coronavirus, the more diverse approach we have, the more freedom people get to think creatively, to come up with solutions, the better results we will have, and we can learn from it. So I think the Swedish model is something people will learn about later on, because, as I said, the numbers support the numbers support the Swedish model. So I think years from now, when we will have the opportunity to reassess what happened from 2020 through 2021, maybe 2022, I think the Swedish model will be very important and a good lesson.
What do you think is the primary explanation for these differences in the results of various European countries' COVID-19 responses? Aren't there kind of underlying factors, maybe demographics or culture or history of some kind, that illustrate these schisms between how countries went both economically in terms of the public safety numbers?
Well, I think, Sherman, you're absolutely right. There are a few countries where, from the beginning, politicians regarded the economy and people's welfare as a top priority, and they tried to balance off the measures they took to tackle the health crisis and to save jobs and to keep the economy going. I think this is also more like a cultural difference between European nations. When we look at Spain, their death rate is 0.14%, slightly worse than the EU's average. But their GDP growth, actually, it's not a growth, it's a contraction, was 13%, minus 13% in 2020. Their unemployment actually had been pretty bad before the coronavirus, but it's gotten worse. So I think there are some countries where people have a special focus on health. Like Spain is one of the healthier countries in the world with the highest life expectancy in Europe. Probably in their culture, there is more emphasis on saving people's lives, on focusing on the medical aspect of this problem, not on the political and economic aspect of the problem. On the other hand, there are countries like the United Kingdom. We talked about the British model earlier, where initially they tried to save the economy. They tried to also balance off the dilemma between the two approaches. And now, as of 2021, we can say that the Brits also imposed severe restrictions on the people. They tried to be more protective of finances, but eventually they decided that they had to catch up with other countries in this matter, and focus on people's health and people's lives.
Going forward, taking into account these cultural differences, do you think that there will ever be a time in the near future where countries like Spain could have a different way of conversation, instead of focusing too much on the health aspect, having more of a balanced approach? Or do you think that this is really something that is just a part of life and something that you can't change? Like a leopard can't change its spots, sort of thing.
Yeah, I think they will. So Spain had a lot of problems, and one of the problems is unemployment. And unemployment is more than 20%, and these are pre-COVID numbers. There's also a problem with their pension system, and the single payer healthcare system they have, I think, will go bankrupt if the trends continue. They won't be able to afford these big national welfare programs. So I think once pensioners will get a reduced pension check, and people will have to pay for healthcare because the system will be overwhelmed financially, I think that's going to be the point when these people are going to say, okay, we need to focus more on free market. We have to focus more on the economy.
Absolutely agreed. It is going to be one heck of a fight in Madrid and in other European capitals, because this is not anything near the kind of conversation groundbreaker that a lot of European countries have faced. And when the numbers hit, when reality starts to hit in, there's going to be a real divide. I think it's going to be a divide between the people who want to keep the status quo and those who are saying we need to just have change. And hopefully there's going to be people, at least someone in the middle, who can bring people different sides together and find a better solution, or maybe a free market solution that is able to still protect people's healthcare. And while I get that there's going to be change in conversation at the very least, one thing that is really sticking in my mind is the problem of the political culture in these countries. Take Italy as an example. I mean, this country has gone through 60 plus prime ministers since the end of World War II. I mean, it's almost crazy to say that. But the political functionality is going to be a huge challenge, and it's not something you can just do in a prime minister's term. This is a generational challenge that people are going to have to deal with, and it's just not going to be pretty when you've got something so rotten to the core running the entire country.
Well, you're absolutely right, Sherman. So there are some countries which had severe problems before coronavirus, as I mentioned. When it comes to Italy, it's a very interesting case because in the 70s and the 80s, while they were facing and experiencing extreme political turmoil, constant turmoil, the economy was going and growing and booming. By the 2020s, I think, and as we also know, they were hit hard by the Eurozone sovereign debt crisis a decade ago, and they still have major problems, and they need structural reform. The problem is, if you have this type of political system, when governments change in 12 months, in every year, there's a new government, a new prime minister, a new finance minister, and whenever there is a government change, they need to fill up the positions. They have to nominate new ambassadors. We know how these things go. I think this is one of the major problems these countries have, as you mentioned, functionality. The lack of functionality is something that prevents them not only from operating their everyday life, but to deal with crises like this. There is one thing I have to say, I need to give some credit to the Italians because they started off badly. Remember what was going on last spring there? But by this year, they managed to flatten the curve a little bit. The previous prime minister who just resigned, Conte, he did a pretty solid job under the circumstances. And now Mario Draghi, who used to be a central banker, has the enormous challenge to keep on to keep the good work going and to continue with fast vaccination. But it's gonna be a challenge because Italy, as a political entity, does not function and has not functioned for a long time.
Similar to how we've looked at the different responses to COVID-19, within the responses is the vaccination rollout. We've seen very contrasting rollouts between that of the UK and that of the European Union. Now, earlier this year, there was a bit of a row between London and Brussels, which I thought was incredibly interesting, but something that I think is just very disturbing about how bureaucracies act. Basically, Brussels was trying to use the fact that AstraZeneca, which makes the vaccines in continental Europe, was trying to give itself a bit of a head start with the vaccine production and trying to get some of those vaccines there, even though they should have had much of a better strategy to procuring and to be able to logistically deliver the vaccines, but they simply didn't do their job. So to tell us about the nature of this dispute and the big difference you believe is between the UK vaccine rollout and the vaccine rollout in the European Union.
Well, the United Kingdom certainly did a better job. Actually, they did a phenomenal job. The rollout in the EU was on December 27th last year, while the vaccine rollout in the United Kingdom was on December 8th. So 20 days before the EU managed to launch the vaccination campaign. And I have to tell you, 20 days is a long time when it comes to a pandemic. There is also something we have to talk about. The United Kingdom is a nation state with a centralized government, while the EU is sort of like a confederacy, still trying to find its own identity and political system. So it's sort of like comparing apples with oranges, but also there's a legitimate thing to talk about this because the EU, although is not as coherent politically as the UK, but in terms of economics and political leverage, I think they could have done a better job. The first thing we need to talk about is how the EU try to help its member states and how the EU try to tackle this problem. For many months, there was a dispute between member state leaders, and by last summer, there wasn't really like a coherent approach. It was last July, I think, when the Next Generation EU Recovery Fund was set up after several prime ministers managed to convince the frugal four and Germany, fiscally conservative countries, that the EU should like do something about this problem. And of course, then came the vaccine rollout. In terms of actually running healthcare, as I mentioned before, the EU had no options really. But in terms of getting vaccines and distributing vaccines, Brussels could have done a better job. So the EU so far signed contracts with six companies, but out of those six, only three are able to distribute vaccines and to produce vaccines at the moment. Pfizer, Moderna, and AstraZeneca. The European Commission signed a contract for 2.6 billion doses, and they're going to distribute them on a per capita basis among member states. And they also set up a two-pillar strategy where one of the main goals is to secure production of sufficient quantities, and the second pillar is to adopt EU rules to accelerate the process. When we think about this, I think this is pure bureaucracy. This is a waste of time in terms of a turmoil. But when we look at how the UK done it, it's interesting. The United Kingdom is able to vaccinate 2.9 million people on a weekly basis. These are numbers, February numbers. And the government promised to vaccinate all adults by July, by midsummer. And most experts say that this is feasible. This may actually happen. So the UK signed a similar contract like the EU did, but there was a major difference. British negotiators were smart enough to include a provision in the contract that whenever AstraZeneca is not able to meet the supply chain it promised, they have to cover it from other markets. So they have to get the vaccines from other countries, and the EU did not include a provision like this in the contract. This is one of the reasons why the UK has done better. The logistics of UK vaccination is way better. There's also another thing I have to mention that the United Kingdom had invested more money in research, and AstraZeneca had been working on a vaccine for a COVID-like virus well before the pandemic came. So the country was better prepared. I mentioned the excellent distribution network. So it's not only about getting and producing the vaccines, but it's also about distributing the vaccines efficiently. So now we have to talk about the NHS again, the National Health Service. We are not a big fan of this system. I think the listeners know it's too bureaucratic, it's too centralized for normal everyday medical procedures. But when it comes to a pandemic like this, the NHS proved to be very efficient. The centralized structure, the planning and the coordination they are able to implement, it helped the United Kingdom to distribute vaccines effectively. On the other hand, distribution is not only effective, but there is a wide access to the vaccines because there are big hubs where big hospitals and vaccination centers. But on the other hand, there are like small community based services providers where people can get the vaccination. So vaccination in the UK is not only speedy, but there's a wide access to it. And I also have to mention that the centralized NHS is supported by a localized system in terms of delivery. So I have to say that these are the main differences that enable the UK to do better than the EU.
I think that goes to show that bureaucracies can act like children because there's no excuse for the EU to do something like what they try to do to the UK. They try to even downplay the efficacy of the Oxford AstraZeneca vaccine, which turns out to be a huge blunder. And now the European nations have to retract that and get their leaders on TV and take the vaccine. It's such a dumb move by Brussels, and they ought to be ashamed of themselves. They just should take responsibility, just grow up, you know? Well, I want to now turn to your country, Pat. You're based in Hungary now. I wanted to focus on this particular country because I think it's important to even get to know maybe some of the ins and outs of countries that don't are not perhaps front and center on the vaccine rollout. But you have an interesting take on how things are going on the ground. So share with us a little bit of what the vaccine rollout is looking like in Hungary.
Yeah, so the first wave in Hungary last year was not very significant. Many people thought that Hungarians will get off of this coronavirus situation easily. There was a rumor, even among health experts, that a mandatory TB vaccination people got as infants is something that builds up resistance to COVID-19. Even though there were restrictions last spring and curfew and schools were closed for a couple of weeks, almost all restrictions were lifted for the summer. But in the fall, the second wave hit Hungary hard. And right now, the death rate is 0.15%, which is well above the EU average. What I also have to say that Hungary also has a single payer universal healthcare system. The system had been experiencing severe problems before the pandemic. The lack of funds, outdated equipment, underpaid doctors and nurses are all problems. And of course, when you have structural problems and there's a turmoil in addition, it totally overwhelms the system. And this happened in Hungary. There's an interesting thing. As a member state of the EU, Hungary is supposed to distribute the three vaccines manufactured by Pfizer, Moderna, and AstraZeneca. These are the vaccines which have been approved by the EMA, the European Medicine Agency. But Hungary decided to get vaccines from outside of the EU and outside of the officially approved realm of vaccines. So from February, the Hungarian government started to vaccinate people with Russian and Chinese vaccination. The problem with it is not only the fact that these vaccines have not been approved by the European authorities, but most Hungarians do not trust Chinese and Russian vaccination. So there is also not only a medical problem with it, but also a political problem.
You know, it's really astounding how particular countries like Hungary have chosen to go with vaccines that haven't gone through the process and don't carry that credibility, certainly that international credibility the vaccines need at this time with this global pandemic. I think this illustrates a much larger, perhaps ideological battle between those who are authoritarian, who don't require and don't want those high standards and processes, versus those who are willing to let the vaccines develop with scientific innovation, with creativity, and with a robust law and order kind of process. Given what we've discussed so far in this episode, do you think that there's going to be any prospect of some kind of change in healthcare policies across Europe?
Right. So I think in the years to come, we will not have a major change. And the reason I'm saying this is the fact that let's hope that most people will get vaccinated by the end of this year or by the beginning of next year, but we will not be out of the woods just yet. And the reason why not is that most health experts and doctors, or even health administrators and politicians say that because of the 12 to 18 months of fighting COVID, most health systems will build up a lot of problems by not letting people getting their screenings and their annual checkups, annual physicals, and this will lead to a higher number of cancer and cardiovascular illnesses. So I think in the upcoming couple of years, most healthcare systems will still be overwhelmed, not by coronavirus, but by other common diseases, which will come up by greater numbers than before. As for how COVID will change healthcare in the long run, I have to say that, in my opinion, healthcare is one of the most important elements of domestic politics in most countries. But also, when it comes to major structural changes in such an important element, there has to be a political upheaval in order to get things done, to get things changed. So far, we have not seen any major political upheaval in Europe. This year and last year, a few governments changed. Most of them not due to COVID. There were corruption problems and the situation in Italy by not having a minority in parliament. What will decide the future of healthcare is what type of response people, what type of answers citizens will give to this problem. If there's going to be a political upheaval, I think we can see a fundamental change. I think people realize that healthcare is very vulnerable. Whether it is single payer, whether it is private, all systems have their own flaws. And I think what people may want in the future is to governments to make sure that whenever the next pandemic will come, they can trust the system, they can rely on the system, and they will get easy, fast, and widespread access to healthcare.
Pat, that was a really great answer. And we are just about time towards the end of our conversation today. I really appreciate you coming back on to Friends and Fellow Citizens again. You share a lot of really great insight. And I just want to give you a chance to conclude with any final remarks you'd like to leave.
Well, I just want to say to the audience in the United States, good job. The vaccination rate in America is really nice, and I think Europeans are really proud of the United States achievements on this matter.
So many people have worked on the vaccines, and it really is about the ingenuity of some really fantastic people who not only have thought of the vaccine and developing it and the research behind it, but also the logistics behind it. We really want to thank those people who do that every single day to try to get us closer to that light at the end of the tunnel. And Pat, again, thank you so much for being on the show. And to the listeners on Friends and Fellow Citizens, thank you so much for listening today. I hope you enjoyed this episode, and I hope you will check out the other ones we have available. Make sure you subscribe and share this podcast with your friends and family. I really appreciate all of your support. Have a great rest of your day, rest of your week, and I'll see you next time. Take care.